I am Dr. Waseem Sajad, and today we will learn how we can classify ischemic stroke into different categories depending upon the age of the stroke. We can divide it into hyperacute, acute, subacute, and chronic forms. Now, it is very important to know by viewing the images of the stroke patient whether at this point of time the patient is suffering from acute stroke, hyperacute stroke, subacute stroke, or chronic stroke. The signals in MRI are very useful to classify the ischemic stroke into different categories according to the age of the stroke, and we will learn how different sequences of MRI and different signals on these different sequences of MRI can help us to classify the stroke into acute, subacute, hyperacute, or chronic forms. So, first of all, we perform at least three sequences: T1 weighted, T2 weighted, diffusion weighted. And with diffusion weighted, we always perform ADC map. So, basically, we have four MRI sequences: T1, T2, diffusion weighted, and ADC map. So, first of all, let's talk about hyperacute stroke. In hyperacute stroke, there is no signal abnormality in any sequence except diffusion weighted and ADC. T1 is normal, T2 is normal, but diffusion restriction shows on diffusion weighted, and on diffusion weighted sequence there is hyperintense signal, and corresponding to this hyperintense signal on ADC map we see a hypointense signal. So in hyperacute stroke only diffusion weighted sequence is affected, and we see diffusion restriction, and it means bright on diffusion weighted sequence and dark on ADC map. Now the next stage is acute stroke. Hyperacute stroke means that up to 6 hours we label it as hyperacute stroke. From the start of the stroke events to the 6 hours we label it as hyperacute stroke, and hyperacute stroke only abnormality seen is on diffusion weighted sequence, and there is bright images and bright affected area of the brain showing restricted diffusion on diffusion weighted, on corresponding dark areas are hypointense signals on ADC map. Now acute stroke means from 6 hours to 4 days. From 6 hours to 4 days period we label it as acute stroke. In acute stroke, T1 is hypointense, T2 is hyperintense, and diffusion restriction is maintained. It means hyperintense on diffusion weighted and hypointense are dark signals on ADC map. Now we need to understand why these signals appear. Now it is easy to understand that when the stroke appears there is edema, it is cytotoxic edema, and due to this edema diffusion restriction occurs due to restricted movement of hydrogen ions within the brain cells, and we see diffusion restriction signals on diffusion weighted MRI and ADC map. Now when there is edema it will appear bright or hyperintense on T2 weighted and hypointense on T1 weighted. Now the next stage is subacute stroke. Subacute stroke means from 4 days up to 2 weeks. It means from 4 days up to 14 days. We label it as subacute stroke. In subacute stroke, T1 is still hypointense, T2 is still hyperintense, but diffusion restrictions start normalizing, and diffusion restriction is not present in the subacute forms, and it start moving towards the normal side. And so on diffusion weighted MRI we don't see restricted diffusion, we see dark signals are hypointense signals, and corresponding bright signals should appear on the ADC map. But because bright signals on ADC means that there is facilitated diffusion, but in subacute forms the brain parenchyma morphology is such that at this stage the facilitated diffusion has not occurred, but the restricted diffusion has also disappeared. So on ADC map we don't see bright signals, rather we see dark signals, and it is due to pseudo normalization from restricted diffusion towards the facilitated diffusion. There is a mid stage in which there is neither restricted diffusion neither facilitated diffusion, and so in subacute stage we see dark signals on ADC map and dark signals on the diffusion weighted. Because there is no diffusion restriction, so there are no bright signals on diffusion weighted and dark signals on the diffusion weighted, but there are no bright signals on ADC because it is pseudo normalization and facilitated diffusion has not still occurred, and it is dark on diffusion weighted and dark on ADC map in subacute stroke. If the brain area shows T2 shine through, then it can appear hyper intense on diffusion weighted. But if T2 shine through phenomena is not present, then it is dark on diffusion weighted and dark on ADC map in subacute stroke. We will discuss later what is T2 shine through phenomena in the coming lectures. So we discussed hyperacute, acute, and subacute. Now the third is chronic stroke. Chronic means after 2 weeks we label it as chronic stroke. In chronic stroke there is encephalomalacia, and on T1 weighted images we see a smaller area of low intensity, and it represents encephalomalacia. And hyperintensity on T2 weighted images is still maintained, and but diffusion weighted and ADC map shows facilitated diffusion, dark on diffusion weighted DWI sequence, and corresponding bright showing facilitated diffusion on ADC map. Again, if T2 shine through phenomena is present, we can have bright signals on diffusion weighted images in chronic stroke, but it is due to T2 shine through phenomena. So we have discussed the MRI signals in hyperacute, acute, subacute, and chronic strokes, and I hope you have understand why these signals appear and why in different ages of the stroke different signals appear, and on the basis of these signals we can tell whether it is hyperacute stroke, it is acute, it is subacute, or it is chronic. Thank you.